I'm going to talk about one of the most underdiagnosed neurological conditions. This condition is called CIDP, or chronic inflammatory demyelinating polyneuropathy. It's a serious condition. It's not very common, but it's often mistaken and misdiagnosed by a lot of doctors, including neurologists. But it is also treatable when caught early. To understand this condition, imagine your nerves as high performance electrical cables, and they're supposed to carry clear signals from your brain to your muscles and from your muscles back to your brain. Now imagine the insulation around those cables slowly being stripped away by your own immune system, and the signal can become weak, and so then your movements can feel heavy and your sensations can become distorted. And this is exactly what happens in CIDP, which is an autoimmune disease where the immune system attacks myelin, which is the protective coating around your peripheral nerves. And without that coating, your nerve signals will slow down and sometimes fail altogether, and people then develop progressive or relapsing weakness, numbness, tingling, and balance problems. If you think this sounds like Guillain-Barré syndrome, you're partially right, but the difference is time. Guillain-Barré reaches its worst point within about 4 weeks, whereas CIDP continues to worsen for more than 2 months or keep coming back. One of the biggest problems with CIDP is that it's frequently underdiagnosed because it mimics many other nerve conditions. It is often misdiagnosed or labeled as Guillain-Barré or genetic neuropathy or diabetic neuropathy. For example, when someone has diabetes, doctors often assume the nerve damage is simply from sugar control and miss the autoimmune diagnosis entirely. Now, there is no single blood test that can diagnose CIDP, and diagnosis requires putting multiple pieces together, such as a nerve conduction test, a spinal tap, and a really good clinical exam. Treatment matters because untreated inflammation can permanently damage the nerve itself, and the therapies that we have can calm the immune attack down and allow nerves to recover, and many patients improve significantly when treatment starts early. So for patients, if your neuropathy is not improving or if weakness is a major feature, even with all the other risk factors addressed, you deserve to see a neuromuscular specialist for a second opinion.